A very good afternoon to everyone today. Here today, based on in conjunction with World PT Day, we are actually having this particular Homage Web Series. And today with me, I have CP Wani, who is one of our physiotherapists that will be sharing some of her experiences while doing home physiotherapy sessions together with us in Homage. All right. Let's start off with asking Wani this. Wani, can you share a bit about yourself and what you do for us here in Homage?
Okay, hello everyone. Assalamualaikum. My name is Raja Shazwani Asdayanti binti Raja Yunus, but just call me Wani, and I'm 30 years old. I have few experience as physiotherapist at Infinite Rehab and also at Taqwa Care. And next, I have experience as clinical instructor. So for information, clinical instructor is uh, teaching physiotherapy student in clinical area lah. And then currently I'm a homage physiotherapist lah.
Great. And how does it feel actually to be one of the Homage physiotherapists? Could you maybe guide us through what made you join Homage as a physiotherapist?
Okay, I joined homage because I think that homage is a one platform that I can expand my career and grow my career because homage has flexible working hours, and so I
Mhm.
can manage my patient based on their time and my times. That's why I choose homage.
Great, great. Now, just a bit about having flexible working hours and as such. One thing to also share with you, how is it that you're able to maneuver around your daily life around these flexible working hours? Do you find it much more easier?
Yeah, because there is no boss, so no
Mm-hmm.
bossy, so no bossy instructions. So I'm the boss. I'm the one who is the boss. So I can manage what time I want to be with the patient lah. Because
Mm, mm,
some
mm,
more
mm.
I have to take care of my parents. So yeah, homage is
Right. So,
such
mhm.
a platform that helps me to be flexible with my patient and my career lah.
So you're able to pursue a bit about your personal life as well as your career as well at the same time. So it actually sort of balances it out much easier for you in that end. Is it okay to
Yeah,
say so? Great,
yeah,
great.
yeah, right.
All right. In your past experiences, as in together with Homage, as well as your previous lives, as in your previous job scopes as well, could you let all of us here know who needs physiotherapy in that sense?
Okay, so who needs physiotherapist? Actually, physio is a people mechanic. Like we have
Mm-hmm, mm-hmm,
car. If our car broke, we have foreman. So physio
mm-hmm,
is people mechanic. So who
mm-hmm.
needs physio is people that have something that broke with their system or body. Like okay, but physio has a broad area lah, such as we
Mm-hmm.
have pediatric, cardiorespiratory, geriatric,
Mm,
which is
mhm,
pediatric. We most of the cases we can see like torticollis,
mhm,
delay milestone. That one is physio to helps to gain their mobility, the functional, and the geriatric to help prevent from falls, uh, helps their imbalance. Yeah, cardiorespiratory and neurology such as stroke, Parkinson, like that lah. Hmm.
great, great. Just to add on to that, like I completely understand that physios in that sense are more or less like I like the way that you put it. It's actually the human mechanics, but at the same
Yeah.
time, I know that doctors as well at that point in time, the way that there's this expression that says doctors put time for their patients and we add quality to that time, which is basically to make
Yes.
to enhance whatever it is that the doctor is actually treating those particular patients lah. Yes, is that okay to say so?
Yes.
Great.
Yeah, yeah, yeah. And
I, And a bit about that is also that right now with Homage, what is the main, like you were saying that there were several different types of patients that you're actually seeing. So what are the different types of patients that you are seeing mainly in Homage right now?
Okay, so in with Homage, most of my patient cases is geriatric lah, which is
Mm-hmm.
elderly people. So
Mm-hmm.
yeah, during we handle the geriatric, you know lah, geriatric have their emotional problems.
Mm-hmm.
So
Mm-hmm.
we have to be very gentle and very open and very patient to attend them. We have to we have to understand their condition, and we give our best treatment to them and to satisfy the elderly lah.
Mm,
Mm.
mm, mm. So that means like you would have to pour a bit more of your emotions and a bit more related to them compared to understand
Empathy.
their situations. Yes, exactly. Being empathetic to how they are and
Yep.
everything lah. All right, great. And
Yeah.
if you don't mind, could you share with us, maybe a few of your experiences with working with some of our patients here in Homage like that? Maybe you would feel that this is a special case. Can you actually bring us, just bring us through that?
Yeah, yeah. I got one most special cases with Homage because the patient is my first visit was very weak, and she is bedridden. After
Mm-hmm.
for 5 session, after 5 session, patient able to get up herself. That is for
Mm-hmm.
me, that is my such a big big what such a big achievement for me, because after 1 year she never get up from bed. Everything people
Mm-hmm.
are doing for her, but after
Mm-hmm.
about 4 or 5 visits, she can manage at least turning herself and from lying to sitting.
Mm-hmm.
You
So
know,
that means you were
but
able to
but
move her from one position to another.
yeah, but the thing is we have to the patient lah, because the patient is not because she's the dementia patient, so
Okay.
she will keep on asking you the exercise
Mm-hmm.
that you have taught, but
Mm-hmm.
she can do, but she will keep asking the same thing lah. So you have to be patient. It's like after 2 minutes, she will ask the same question.
So you're saying here that there's a lot of patience that goes into this when you're treating geriatric patients. Is that so?
Yep.
Mm, 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 mm. And this experience had actually now this was actually able for you to actually conduct such treatments and stuff because of your background in physiotherapy. And was there anything else from your past experience that actually helped you in treating this patient?
Yeah, because actually I love to do home physiotherapy because I can do exercise based on home home condition and also the patient condition. So I will choose a proper exercise that suitable
Mhm.
for the patient and the home as home surrounding lah. Mm-hmm.
All right, all right, cool. Now let's come into a typical home physiotherapy session with us in Homage lah. So can you walk us through how it is basically starts out and how does it end through a typical home physiotherapy visit with Homage?
Okay, so because I what I love most about Homage is the system, because we Homage
Mm-hmm.
have system. So
Mm-hmm.
everything that I done to the patient, we have the black and white lah. So
Mm-hmm.
if there is there is something happen to the patient, so we have the record.
Mm-hmm.
That's why I choose Homage, because uh, yeah, because
Because you have that
like
transparency, that visit recording
yes.
and all that data captures and stuff like that, correct?
Yeah, yeah.
Great. And basically, like when you're starting off the visit, I'm quite sure basically, like, one of our team members from Homage would basically, be informing you of how the situation is like and everything, getting you up to speed. And
Yeah.
then I'm quite sure then after that you will move into the visit and so on. Now I get that the home physiotherapy is it any different compared to a physiotherapy session within a center itself, or is it like all in the same?
I know it's for me that is different because there is a study that mentioned home
Mm-hmm.
physiotherapy can increase the recovery time more faster than family
Mm-hmm.
members will focus on the patient,
Mm-hmm. Mm-hmm. Mm-hmm.
and then the patient will be no pressure from others because if we see this type of
Mm-hmm.
patient that and then maybe they got the same cases but the progression are slow, maybe so the patient will get stressed because see like that lah.
Mm,
So
mm, mm, mm.
for me,
I agree
home
with you. I
physiotherapy
agree
is
with that.
like
Mm.
mm,
No,
so
you
for
say?
me, physiotherapy
Mm,
recovery in house is faster
mm,
than in the center. And one more thing,
mm,
we can save our the patient can save the time and energy lah because yeah, sometimes patient bedridden and family members has to transfer the patient, so no need lah now. Now everything
mm,
is at the finger, so just we
mm.
come to the patient house and then we teach the family members and then like that lah.
Mm. Mm-hmm. I agree with you on that end because I've had past experiences also using home physiotherapy for some of my family members, and yes, I saw that there's actually a good vast difference in that sense because one of my experiences personally was that to actually have physiotherapy sessions done for my younger brother, who was at that point in time, of course, he was suffering more of a another chronic problem, and we had a physiotherapist to come over, to watch over him because at that point in time he was undergoing chemotherapy in that sense, and he had to have someone to go through with him with the rehab process consistently and constantly, which then we saw that he started to be more active, he started to come out of it, and because he was younger, so it was actually much easier for him. And I feel age as well here plays a big factor in that sense lah, because
Yeah,
like you mentioned earlier as well, like the older patients, they suffer from other conditions as well, such as dementia and other neurological conditions, which may deter them slightly more compared to the younger ones.
yeah, yeah, true, true.
Um, Now, aside from just, of course, faster recovery and accessibility, what other things do you think that are benefits of in-home physiotherapy in that sense?
The family bonding, yeah, we can
Family bonding. That's a good one. That's
yeah.
really nice. Yes. Huh?
Yeah, because if we like we go to the hospital, like maybe not family members cannot be participate, but in house
Mm-hmm.
we have to
Mm-hmm.
teach the family members and we will rapat dengan the patient jugalah and the family
Mm.
members. That one is main thing for me because I love bonding because bonding and
Mm-hmm.
recovery are associated also lah.
Mm, mm, mm. I think I read that somewhere as well. Like being going through treatment procedures with related with family and stuff like that. I think it also, yes, in a certain extent it also helps was that escalate or enhance the treatment progression, like in that sense it also helps to make recovery faster, speed up recovery and so on. Yeah, and I think also on the accessibility part lah, I think that one also plays a big role, like in that sense, wouldn't you say so?
Yeah, but I'm agree.
So basically, it's more on the accessibility and
Yes.
I think it's mainly from there lah. Yeah. Thank you so much, Rani, because I wanted to actually, we maybe can start taking in questions from the from the crowd after this. Once we start getting more questions, and then maybe we can answer them together. Is that okay?
Okay, all right.
Right. Okay, so we have a question from Melanie. Maybe can I ask you, Wani, maybe know the main
Yeah.
difference between physiotherapy as well as occupational therapy?
Okay. Hi, Merlin. Okay.
Mm.
So the difference is physiotherapy and occupational therapy is physiotherapy mainly for the mobility. Occupational
Mm.
therapy is more on functional activity.
Mm. Okay.
So like if the I give you an example. If the patient having a stroke, okay, so once the left side stroke, okay, physiotherapy for me, my aim for the patient, mainly I want to move the patient, I want to give the strength to the patient back. So
Mm.
for the occupational therapy, maybe they train how to button up, how to comb the hair.
Mm.
That is the difference between physio and occupational therapy. Yeah.
Great, great. I think just to add on to that, Melanie, it is actually quite true. The difference between physiotherapy and occupational therapy in that sense is actually quite distinct lah. Because physiotherapy, their goals are mainly to be on symptom driven or symptom based. So it's to alleviate some of the symptoms that are being suffered by the patient. Occupational therapy in that sense is more towards functional side of things lah. So you can also look at occupational therapy in that sense. Like like how Wani was suggesting earlier, like buttoning up your shirt, maybe combing your hair and those kinds of things. But Wani, I just want to check with you also on something else. Can we integrate physiotherapy with occupational therapy at the same time?
uh, we we have to set the goals, but
Mm.
mainly, but physio cannot be occupational therapy.
Mm.
Therapy cannot be a physiotherapist. Okay, because
Yes, okay, understood.
we have, yeah, we have our different aims actually. Yeah,
Mm, So that means we still can combine occupational therapy and physiotherapy, like in a sense, two separate treatments, but then they work together lah to achieve better goals. Like you were mentioning, like
yeah,
if let's just say we were to get a stroke patient to come in, and then you are saying that of course we want to be able to move them like from lying to side lying to sitting to standing. But of course, once they're standing and walking already, then you have to move into more advanced movements, like buttoning up your shirt, combing your hair, drinking water, holding a glass. So these kinds of things all will come to more functional activities, which would then we need to integrate occupational therapy into it, lah. Correct or not?
yeah, yeah.
Yes,
Yes.
I think I see that as well. I think that's one of the best integrations that we are also doing currently, which also Homage also does provide occupational therapy in that sense lah currently. Okay. Any other questions that we want to take currently? Yes, from Jocelyn. Okay. Um, so will the CPs be trained to carry out simple in-home physios for CRs? So will our CPs be trained? Okay, so this one maybe Wani, you would want to take this. So are you trained to carry out the simple in-home physio for the patients?
Yeah, I will. If patient got caregiver, I will teach simple exercise like one two
Mm-hmm.
exercise that patient and carer can do for the patient, like maintaining
Mm-hmm.
the condition lah.
Mm-hmm.
Such as maybe I will teach like how to turning the patient, or how to transfer the patient without caregiver having any future problem like back pain, any pain like that lah.
I think just to add on here, it's just that it's actually quite true because CPs on our end, when they are coming to the Homage platform in itself, one is that they are qualified, and we give a lot of emphasis to this. We make sure that they are qualified with at least a good number of hospital years of experience lah, so that when they are when
Yeah.
so that we know that our care professionals out there are of quality, and they are going out there, and the treatments that they're actually doing outside that is actually recognized, and it's actually what is pertaining to the particular condition lah. Yeah. And then aside from that is like you mentioned as well, I think it's a lot of educating that we need to do for the caregivers that on the other end, because of maintaining their conditions, to make sure that that whatever it is that we are doing also, that is actually being continuously consistently done, so that we
Yeah.
make sure that the progress is adhered to. There's actually a good progress. Because if let's just say we're going to come, like, you know, like you and me both know, Wani, like, you know, with PTs, we go in, we do a session, like maybe say once a week, or 2 weeks once, you know, that kind of thing. It's not going to be very beneficial. There will be maybe very minor changes to it. But I think it's more towards consistency and the homeworks that we give to the patients or to the caregivers to make sure that the patients are adhering to it. I think it goes back to that. Yeah. Mm.
Yeah, yeah, true.
Yeah, I think I yeah.
And it's beneficial also for the caregiver because they handle the correct technique lah. Because if they always perform the wrong technique, and it will harm the caregiver also lah. That's why we have
Mm.
to maintain the patient condition, and also we have maintain the caregiver punya condition also lah.
So we want to safeguard the caregiver pun sekali lah. We don't want them to
Yeah,
get
yeah.
into any injuries ke or something like that. What if I can ask you, Wani, what are the common injuries that are suffered by physiotherapists in that sense, when treating patients? Because this is something that we commonly understand that something occurs like this. But what are the common sort of injuries that physiotherapists may suffer from?
Back pain.
Back
Back
pain lah,
pain
quite.
and
Uh,
yeah lah.
okay,
Because
so
yeah lah,
mainly on
sometimes
back pain.
yeah lah, mainly
Mm.
back pain because sometimes we handle patient more bigger than me more bigger than our size. Sometimes we do we perform the correct technique, but sometimes yeah lah, humans still humans.
Mm.
So not to not to what we call not uh do the correct technique also lah. We sometimes
Mm.
cincai also lah, like that.
So that means it's just basically goes back to education, how we educate some of our physios and some of our clients to make sure that they avoid such injuries as well lah, because it still goes back to work related injuries lah. Correct or not?
Yeah, yeah, yeah.
Yes. All right. Great. Maybe let's take on more questions then.
Okay.
Mm, all right. So Hannah is asking us, what can I expect from my first in-home session? Maybe you can let us know, Wani, what is it that usually we do on the first session of the home PT?
Okay, usually my first session with client is I will assess the patient condition lah. What and then such as okay, if we got a patient with stroke, so we have to know how long the stroke already and what treatment they give. Other patient in still in the on medication or what, and then and then then kita tahu kita akan assess overall the patient punya problem lah, and then we
Mm,
give simple exercise. For first visit is education for the family lah, and
mm,
treatment.
So mainly, if I can summarize that, it's mainly the first one is mainly on assessment. So I think the first visit is usually slightly longer, right? Correct, betul tak? Can I say that? First visits kan biasanya slightly longer because there will be an assessment and treatment as well.
Yeah, sorry.
No problem. Can you hear me?
Yeah. Sorry,
All
there
right.
is
Okay.
technical error. Okay.
No problem. No problem. All right. So, what I was asking is that can we say that the first session, usually first in-home session, is usually like, you know, it takes longer.
Yeah, it's more than usually if stroke patient I will take about more than 1 hour lah. It's
Mm,
more like
mm,
1 hour 15 to 30 minutes lah,
mm,
for first
mm,
visit
mm,
because we have we have to dig all the problem, all the history from the patient. Yeah.
I think history taking is the most tedious one, like the one that we have to, correct balik what actually happened previously and everything like that. And then once we get all the information already, then it comes back to the assessment. We basically different conditions we have. I think different set of tools, different set of assessment tests and everything that we have to conduct as well lah. Yeah, I think that
Yeah.
is actually then in itself it actually will be a bit time consuming. That's why I think the first one, the it's a bit longer, and which
Yes,
is
yes.
why that which is why that we have to be a bit more in detail, because I think the first one again is very important, because once we set the goals, we are already setting the benchmarks and the goals already, and from there we need to hit our goals. That's why all our treatments after that need to be like driven to that goal. So if like the first one, like you were mentioning earlier, if it's a stroke patient, or if it's like let's keep it very easy, like if it's like a back pain patient, then after you will see like there's weakness dekat lower limbs and stuff like that. Then of course we'll do a benchmark, right, like an assessment. Okay, so your muscle power is like this much. Then after that we need to, the aim is we need to hit this much of muscle power, that kind of thing. And then we do our treatment goals like according to that. So of course the first in-home session, you can expect a lot of assessments, a lot of questions, and a lot of history taking mainly. And of course we'll be informing patients lah, of their goals and of the treatments, what we are aiming to actually achieve together with them. Yeah. All
Yeah,
right.
yeah. True, true.
Great.
Okay.
Okay. Yeah. Any more questions that we can take for now? Hmm. Okay, so we have a question from Zainab. What are the chronic conditions that actually need physiotherapy? I think this one, right? Let's look at it, because I think chronic conditions, there are several different ones. So maybe let's look at the ones that you've tackled so far. Wani, maybe you can highlight some of them.
Yeah.
Maybe you can highlight some of the chronic conditions that you've actually treated so far.
Okay, maybe osteoarthritis,
Mm-hmm.
or yeah, like yeah, I osteoarthritis,
I think we're
for
having
the
a bit of
elderly lah,
technical
mainly.
difficulties. Mm.
And then bedridden punya patient, bedbound patient, like
Mm.
astro, and for geriatric also the knee pain,
Mm.
back
Mm.
pain, the knee
Mm.
pain that causing the geriatric cannot move, like
Mm.
very
Mm.
severe knee pain. So we have to teach the patient simple exercise lah to reduce the pain at the knee. Yeah.
I think in itself, right? I think let's look at it like diving into chronic conditions in itself. We look at chronic itself. Chronic meaning that of course anything above, if I'm not mistaken, anything above 6 months. Anything above 6 months, correct? So anything
Yeah,
above
yeah.
6 months is actually considered chronic. Anything before that is subacute. Then the earliest point in time is actually acute. So if you're looking at chronic conditions in itself, so if you have like if you are having osteoarthritis, like knee pain for the next 6 months, then you already considered like it's actually sort of like a chronic condition already. But physiotherapy in itself is appealing or applicable to everyone that requires functional that has functional impairments, that has a movement disabilities, and in that sense joint pains, that we are looking at musculoskeletal side, and then we have neurological conditions as well. But then chronic conditions in itself that can be appealing, some of these chronic conditions include osteoarthritis, because osteoarthritis is quite chronic in itself. Osteoarthritis, you would say, is presentable maybe say like maybe 6 months to a year down the road. Down, you're going to have this sort of as in this sort of diagnosis coming to you when you are already suffering for that long. Stroke also is a chronic condition, because stroke doesn't disappear lah in that sense. So the effects of stroke is actually chronic because it passes down, goes past 6 months in that sense. So of course stroke and then other neurological conditions, because they are more or less, these neurological impairments are quite permanent. They cause permanent damage in that case. So because of that, we would say that they are more chronic conditions. Yeah. So of course, chronic conditions that actually need physiotherapy would be including of osteoarthritis, maybe even uh, this degeneration disease that we see on lower back problems. We also have cervical spondylosis as well as one of them, which is the wearing of the cervical joints as well, the cervical discs. And then, of course, we have strokes and other neurological conditions that may be included into chronic conditions that actually need physiotherapy. Yeah. Any other questions? Another one from Hannah. All right. Wani, what can caregivers do to assist with recovery after engaging with physiotherapists?
Like I mentioned earlier,
Mm,
the caregiver have to continuously do the exercise
mm,
to
mm, mm.
for the recovery lah.
So I think it just goes back to us educating the caregivers untuk buat exercise tu lah,
Yeah.
like letting them know that you all can do these exercises, and you all basically just need to consistently do it, because the important part here is consistency lah. That's what we want the caregivers to know lah. But is it hard to train these caregivers? I mean, your experience lah, Wani, have you had trouble training these caregivers?
No, but it's sometimes it depends on the caregiver also lah. Sometimes we got the malas caregiver, that one is also not too good lah. So but sometimes caregiver so bagus and it's more than physio lah pula, nanti dia tanya what we can do more for the patient.
Yeah, yeah,
So
okay.
yeah.
Yeah, but I completely understand. It just goes back to, like, it's more like having a conversation with them also lah. But then we
Yeah.
do our best to also still train the caregivers juga, sebab we, at the end of the day, kan kita nak outcome kan. We want the outcomes to make sure that the patients are achieving the outcomes that we're
Yeah,
actually heading
goals.
to. And in order for us to get the outcome, we need consistency lah, basically. So yeah,
Yeah.
I think caregivers, if we teach them this minor exercises, can you also, on that note, can you also tell me what are the different exercises that you are able to teach caregivers?
Pardon? Sorry?
Can you also let us know what are the different exercises that we can teach caregivers to actually do? Hmm.
Yeah. Okay, so macam stroke patient,
Hmm.
I will teach maybe passive movement if the patient so long time not move. Yeah.
Mm-hmm, mm-hmm,
Or
mm-hmm, mm-hmm.
or the mobility lah.
Or the mobility lah, as in mobility exercises lah, bed mobility exercises and so on lah. Okay, all
Yeah.
right. I also wanted to check on one thing lah, is that I know that these are the exercises that we can actually teach the caregivers, but then this one is mainly for stroke lah. But then what other exercises, like we have other types of patients as well, like of course commonly
Yeah.
the main musculoskeletal problem that we see with elderly patients are, of course, one in two, because they're very fragile. So we see a lot of fractures, like neck or femur fracture and hip fracture and so on. So for those kinds of patients, what do you teach the caregivers for mainly on musculoskeletal fractures? Mm.
So I will teach the exercise that appropriate with the patient, and then
Mm.
I will make sure the caregiver always be there because with the patient, because I takut dia akan jadi more
Mm-hmm.
worsen and tak nak patient jatuh lagi lah.
Mm.
So the caregiver will always selalu dengan patient,
Mm.
and maybe kita akan ajar mungkin kita ajar cara nak placement untuk bawa patient bila patient dah boleh jalan, so kita ajar carer how to pegang the patient supaya tak jatuh lah in standby.
Hmm.
Standby.
Hmm. I have a very peculiar question here to ask you, Wani.
Hmm.
Can physiotherapy help reduce risk of fall?
Yeah, we must do the balance exercise. Always
Yes.
do the
Okay.
balance exercise and give the strength back lah for the patient.
So that means you're saying that if we do physiotherapy, then of course patients get to reduce the risk of fall lah. Betul tak?
Yeah, betul.
Of course, other than balance exercises or balance testing, balance assessments, and everything, what are the common exercises that you can say that can maybe help reduce the risk of fall?
So I will do most common. I will do balance exercise such as sit to stand and
Mm-hmm, mm-hmm,
so I will teach the caregiver lah to stand by which part.
mm-hmm.
Like maybe caregiver will put
Mm,
some stones in front of the patient so that the risk of fall is reduced lah.
mm. Okay, all right, okay, great. So in order, just want to thank you again, Wani, for helping me answer all these questions with us today, and thank you for spending the time with us today. Thank you for sharing your experience with us, and also thank you to all our viewers for actually tuning in today. Last but not least, we are also excited to announce that in honor of the World Physiotherapy Day, we will be offering the 10% off all our home physiotherapy services for the entire month of September. For more details, you can actually visit the link below, homage.care/physiomy, or call us at 016-299-2188. Right? Now, we will be departing from you shortly, but of course, please stay tuned for our future Homage Web Series episodes for more information. And of course, if you guys have any other questions that you'd like us to answer, feel free to reach out to those links and phone number for us to get back to you guys on any other inquiries. All right. Until then, thank you so much again, Wani. All right. And thank you
Okay.
all to all our viewers. And we will see you guys again soon. Thanks, guys. Bye bye.
Bye.